today I'm going to talk about this ongoing pandemic caused by the novel coronavirus 2019. Coronavirus is a whole family of viruses that
Little spikes on the surface that looks like a crown, which is how to get its name.
you've probably heard of another type of coronavirus. There was the SARS coronavirus. The outbreak was in 2002. There was the MERS coronavirus with the outbreak in 2012. And there are actually a lot of other types of coronaviruses. The virus that we're dealing with is called SARS-CoV-2. And the disease that it causes is coronavirus disease 2019 or COVID-19 for short.
Bats are actually a reservoir for many viruses.
So the virus can replicate inside the bat without making it sick.
They pass it on to other animals, then transmit it to humans.
So after one is infected, it can pass to person to person to person by coughing and sneezing.
But one cough can spray 3,000 droplets that can go all over the place. If someone coughs or sneezes on your face, you can get direct transmission of the virus.
But if the virus lands in the air, it can stay flowing there up to 3 hours. And if it lands on cardboard box, it can stay for 24 hours. But if it's on plastic, it will be there for 2 to 3 days. So if you touch the surface and rub into your face, then you get infected. So what happened to your body?
When the virus enters to your body, it uses those proteins in its surface, the ones that look like a crown, to get into our cells. Those particles are like key that unlock the receptors outside of the cell. We believe that specifically the ACE2 receptor on our lungs that coronavirus is using to get inside the
Once
cell.
the virus is inside the cell, it then releases
RNA, its genetic material, and it tricks the cell to make copies of the virus. So your cells become the factory producing thousands of viruses without even realizing it.
So at the beginning, when the virus is replicating, you don't have the symptoms yet. And if this is called the incubation period. So it's different from other viruses, but the case of COVID-2, the incubation period is 5 days. So 5 days where you've been infected and don't have symptoms yet.
New coronavirus, 2019 novel coronavirus. The seventh coronavirus found to cause illness in humans, and previous viruses that have caused human epidemics include MERS and SARS viruses. Novel beta coronavirus, group 2b, RNA virus, and it has been shown through genetic analysis. Similar to bat coronaviruses, in fact, it has been shown that 96% related to a bat coronavirus. Bat are likely original source, but complete mechanism of transmission is unknown. It shares an approximately 80% sequence homology with severe acute respiratory syndrome coronavirus. The World Health Organization declared a public health emergency on January 30, 2020. Where is the origin? Originally started in Wuhan, Hubei province of China, the city of more than 11 million people and the seventh largest city. There were cases recorded in December 2019. They were deemed of pneumonia of unknown cause. The first patients hospitalized recorded on December 16, 2019. That was the first date that we known so far, but initial infections estimated to be as early as November 2019. And after multiple sporadic cases began to increase in Hubei and across China, that was reported to WHO on December 31, 2019. It all started to begin in Huanan Seafood Market. Initially the place, this would start to have originated through cross-species contamination or through transmission from a bat to human, because most initial patients work or visited. Subsequent cases began to pop up, which many involved healthcare workers, family members of patients, and raised possibility of human transmission. Symptoms of coronavirus. Patients with COVID-19 have experienced mild to severe respiratory illness. The symptoms include fever, cough, and shortness of breath, which may appear 2 to 14 days after exposure. Seek a medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or have recently been in an area with ongoing spread of COVID-19. Preventive measures. Health officials are recommending social distancing as a way of limiting the spread of COVID-19. But what exactly is it? Social distancing basically means staying away from crowds and locations where you can spread the virus to many others. This means working from home and avoiding large gatherings, including concerts, conferences, and other cultural events. WHO suggests at least 1 meter distance between yourselves and anyone who is coughing or sneezing. This distance is recommended because the virus is spread via droplets of bodily fluids from an infected person. Officials say social distancing is one way to help flatten the curve of transmission. As you can see, which means spreading out the numbers of an infection over time. When the curve is flattened, it gives the healthcare agencies more time to respond to crises, which also ensures there are enough hospital resources like beds, ventilators to meet demand for the most sick. Here are some recommendations from WHO on how to prevent the spread of the virus.